That's our commitment to you, to coverage you can count on.
Sky 3 on Channel 3, the first to fly live.
You know, if you have watched 3+U over the last year or so, no doubt you too have come to love Dr. Tiffany Ahlberg at Ahlberg Audiology. She was kind of a monthly guest with us there for a while, and so happily we're kicking off 2021 with yet another visit with her. Good morning to you.
Good morning, Julie.
You always have a way of bringing a new topic for us to think about when it comes to audiology needs and conversations out there, because the truth is hearing loss affects people of all ages, and what you can do to treat it continues to change and become more and more effective.
That is true.
So you were sharing with me that you kind of want to talk this morning about cochlear implants. As I understand it, there's a new reason to be excited if you're in the Chattanooga area because you have easier access to the surgery now. Is that right?
It is, yes. There are physicians in Chattanooga now that are able to perform the surgery where in the past we had to refer out to either Knoxville or Vanderbilt.
So what exactly is a cochlear implant, Tiffany, and how do you determine who's a candidate for it?
So a cochlear implant, and I have this little image here, but a cochlear implant is actually an implant that is under the skin. There's like a magnet, and then there's an electrode that is curled through the cochlea area. So when it penetrates the cochlea, some of those hair cells that aren't functioning now have the electrode to stimulate that area and produce hearing. It's a different kind of hearing than what people are used to, but it is hearing. And so it takes a little time for people who are getting used to it to actually learn how to interpret the sounds in a completely different way. But there are three companies that do cochlear implants. There are Med-El, Advanced Bionics, and Cochlear. We in our office do the programming, not the surgery, but the programming for two of those, Advanced Bionics and Cochlear. And so they're a little different as far as how they look, but for the most part, the part that's inside the ear is about the same. And you have either, on one of them, you have a piece that has a magnetic pull, and this is where the microphone actually pulls in the sound and then transmits it into the ear. So that's where the sound is coming from. So you still have something, even though it's an implant, on the outside of your ear. They did just come out with a new one through Cochlear that only has one piece, if you're able to see that, and that one piece just sticks on the head. And so it basically does most of the same things that the other piece did before, but it's a lot simpler and easier to attach. So that's kind of what it looks like.
Okay, let me ask you a couple of questions, can I?
Yeah, oh, of course.
Okay, so once that implant goes in, is it permanent? Like if a child gets a cochlear implant, I know you see mostly adults, but if a younger person gets one, as they grow, does that need to be replaced?
So yes, it is permanent. So it is a decision that you have to make and know. But they have come so far that for people who are candidates for it, there's really no reason not to get one, because they're such a blessing, and the advancements that I see people make from when a hearing aid was not working for them and when they moved to a cochlear implant and how much better they're able to hear, it is just amazing. But the implant itself internally very rarely has to be replaced. So there's usually not a need for any further surgeries after the first. The processor on the outside is replaced, and most insurances will cover a new one about every 5 years. Okay. So it's kind of like a hearing aid, where that piece they update and they have different technology, and so that piece is replaced about every 5 years.
So how do you determine who is a candidate for it?
So different insurances have different determinations as far as how that person will qualify for a cochlear implant. The most common numbers are 70 dB. So if a person is at 70 dB at 5, 1, and 2, then that qualifies them. Also, the word understanding of 50% or less. Now, that's usually for commercial insurance. Medicare has a little bit stricter guidelines. I believe Medicare's guidelines are 40% for word understanding before they'll pay for it. But that is and we do some testing in the office to make that determination.
So if you're a person, because I know hearing loss is not reversible and it can get worse with time. So if someone comes into your office and you begin to treat them with a hearing aid, and then over years maybe their hearing just declines to a point that they meet these standards, then they could consider getting the cochlear. Is that how it works?
So if someone comes in, we see a definite decline in their hearing, and in the audiological world, we see they're probably a candidate, or maybe they're a borderline candidate. I mean, sometimes we know for sure they're a candidate, but even if we know for sure, we still have to complete the necessary test that insurance requires, which is it's just a more complicated test than what we usually do to make that determination.
Okay, I'm curious to go back to something you said earlier about how the sound, once you do get your hearing back, it still is a different kind of hearing than what we experience. I think in your office, if you're the family member of somebody going through hearing loss, you're able to kind of mimic for them what their loved one, how sounds appear to them. So is the same thing true with the cochlear? Can you learn how your loved one is hearing now?
So there's a way, we have a system in the office to where we can put a hearing loss through a filter and say, this is what the sound would sound like with normal hearing, and this is what the sound would sound like with their hearing loss. So that part of it we're able to replicate. When it comes to how people hear with a cochlear implant, that is not as easy to replicate. Most people who have had hearing and then lost their hearing describe what they hear initially with a cochlear implant, like Charlie Brown. It's a lot of nonsense at first, and so it does require a lot of oral rehabilitation to where they have listening tasks, and they want to do that every day or multiple times a week and listen. And it really is amazing how quickly people get that better hearing with a cochlear implant. And even though it sounds terrible at first.
And is that because is the muffled, I guess, Charlie Brown like sound, is it because your brain in a way has forgotten how to hear? Is it a retraining?
It is a retraining, but it is a completely different way that person's hearing than they've ever known before. So a cochlear implant does not replicate normal hearing. It gives that person the perception to hear in frequencies that they have lost, and maybe they have dead regions in that area, and a hearing aid cannot help if a person has dead regions in their cochlea. So the cochlear implant has the electrodes, and it produces more of an electrical stimula. So whenever that hair cell region is stimulated, it's more of a mechanical sound than an acoustic sound like we think of with a hearing aid. And so that is why it sounds so artificial and foreign at first. But with just repetition, as far as hearing over and over and over, the ability to understand words is amazing. I tested someone just the other day that had a hearing aid. She was at 16% word understanding in both ears. That means that out of 25 words, she was able to understand 4 in both ears before she got an implant. I tested her the other day, and she was at 68%, and she's 6 months post-implantation.
Isn't that amazing, the resiliency of our bodies?
Yes, it is.
Okay, so are you seeing new patients right now at the office?
Yes. This is something that the programming part that we do in our office.
Okay, let me let people know how they can get in touch with you. Thanking for kicking 2021 off for us with a visit, Tiffany. It's always a joy to talk to you.
Thank you. It's a joy to talk to you too, Julie.
Dr. Tiffany Ahlberg at Ahlberg Audiology in Cleveland. Their address there on North Ocoee Street. Phone number is 641-0956. You can also learn more online at ahlbergaudiology.com. We're back after this.
I feel like I'm the good kind of spicy. It means you got an edge. I got an edge.
It means you got some and I got some
I don't know about your